Hey guys, it's Dr. Justin Marchegiani here. Hope everyone is doing phenomenal. We're going to dive in here and do a live Q&A sesh in just a bit. I got a bunch of questions here as well. Sorry, I'm running a bit late here at patients, and I decided my blood sugar was going a little bit low. I need a good lunch before I dive in. I had like a meatball soup, which is a bunch of veggies, and then I used some of the siete chips on there as like some crackers, which is really nice crunch. Very cool. Well, I got a whole bunch of questions here, y'all. Awesome. Let's dig in. So Dennis writes in, Dr. J, I heard a psychiatrist say that people with ADHD should eat a high protein breakfast. What's the rationale behind this? Yeah, I totally agree with that. The rationale is blood sugar stability. Typically high protein also will mean some fat. We want to have some good fat there too. That's going to create blood sugar stability. So our blood sugar is not going up and down, which can create issues focusing. Also, a lot of the proteins in it contain a lot of the amino acids that are going to be precursors to a lot of our healthy brain chemicals, serotonin, GABA, and dopamine and adrenaline. So we need these healthy brain chemicals, and it comes from protein. So it's blood sugar stability as well as building blocks for our brain chemicals. And then also, we're not eating a lot of the dyes and preservatives and junk that tend to be more stimulating and inflammatory. Jack JMC writes in, does drinking celery juice really have benefits like increasing HCl naturally? Well, I mean, you're going to get some minerals out of it. So if you're getting more sodium and chloride, you can get similar effects through good quality sea salt like Redmond's real salt. So yeah, you're definitely providing more building blocks, which will be helpful to make more of your own HCl. Have you heard about Heal Your Gut? The Heal Your Gut guy, it says that stomach acid, all inflammation to the gut is because we eat hard to digest foods all the time. Well, it depends. I mean, if you're eating proteins, that's going to be harder to digest. And if you're eating when you're stressed and you're eating and you have a whole bunch of inflammation in your gut, it's going to be harder for you to activate your parasympathetic nervous system and make your own HCl to be able to digest things. That's why the best thing to do is follow the 6 R's, remove the bad foods, replace the enzymes and acids so we can better digest our foods, repair the gut lining, repair the hormones, remove the infections, reinoculate, repopulate the probiotics, and then retest and make sure we are clear. So it's really important like that. Brilliant Images 71 says, my daughter uses the Mirena IUD. It's been tough on her hormonal balance. Is there a safer IUD you know about? Yes, I would definitely, if I had a daughter and that wanted a kind of all the time pregnancy type of preventative method, I would look at using the Paragard IUD. It's copper. So you have that issue, but if you get enough zinc in your diet, that can help with the balance the copper out. Also vitamin C flushes out copper too. And I would do that because that's more of a kind of prevents the implantation of the egg. I would do that. And I'd also, you can also have your daughter also chart her cycle too using a Kindara app. That way she kind of knows if she has a good rhythm, she can kind of know where she's most fertile as well. So you can do that and then have the IUD there as well. Little Voice writes in, what's the best sort of collagen supplement powder for anti-aging skin? So mine's 1 in 3. 1 in 3 is really good. That's like the predominant collagen that you're going to get in bone broth. 2 is also good as well, but 1 and 3 are the big ones. And we want to make sure we get enough of it. So if you have skin issues, you want to make sure, 1, you're eating enough protein and fat, your digestion's good, you have enough HCl, you're having good bowel movements, so you have no infections in your gut. Once that's good, then you can add in some of the extra antioxidants on your, extra collagen via supplements and food. And then we can always add in some topical vitamin C and vitamin A, which is great for collagen as well. But we want to do it inside and out. Is it true that bone broth and collagen supplement powder can be contaminated with heavy metals? Yeah, you want to make sure it's good quality. I get mine from Argentina. It's, grass-fed and relatively organic. I don't have an organic label on it because it just increases the cost like a ridiculous amount. But I source it from, grass-fed organic farmers that they don't pay for that label. So because they don't pay for it, I don't put it on the label, but I'm able to get it cheaper and I don't have to sell it for a high enough price to get my money back. So that's the one that I personally use and my family uses too. Paula Hearn writes, after eradicating H. pylori, is it less possible I will get it again if my gut's in good shape? Yes, it will. And then big thing is make sure your partner's also checked if your partner has H. pylori. And I'd also say make sure, the gluten and the inflammatory food's been addressed too, because a lot of people just keep their gut chronically inflamed with the foods and they can easily get reinfected, or they just have it's knocked down to a low level and kind of can come back because there's so much inflammation in the gut. And then also make sure HCl is dialed in as well, because we have to make sure we have enough hydrochloric acid to be able to break down our proteins and fats. And H. pylori is notorious for actually decreasing stomach acid. It does it because with the protein digestion from urea. There's an enzyme that H. pylori produces called urease, which then takes the urea and it metabolizes it into CO2 and ammonia. And CO2 is what causes the H. pylori breath test to test positive. It's a high amount of CO2. The ammonia's got a pH of 11, so that actually increases the alkalinity. So it decreases the acidity. It makes the pH go up. And then that moves it away from a nice acid pH, which is where it needs to be so you can digest your proteins and fats, and then also activate all your enzymes in your small intestine and also activate your gallbladder. Really important. See here, Nora writes in, what's your viewpoint on the mold illness that are sometimes doctors specializing in? They say many people who are affected have a really hard time finding a safe home. So yeah, mold's one of these double-edged swords. I call it a rat hole in functional medicine because if you look at mold symptoms, they could be anything. So my first thing is, do you have any active mold issues in your house? Like any leaks, any visible mold? Step two, if you really feel good leaving your house for like a week or two, do you feel good? And then do you, when you come back to your house, do you feel worse? And again, you got to kind of like, you know, kind of equal out the fact that if you're on vacation, obviously you may have less stress. So you kind of have to, you know, equal out the stress thing. So if you think there's mold issue, there's some various tests you can do. Immunolytics has one, Real Time Labs has one, ERMI has one. I'll be testing my house with the Immunolytics kit really soon. But those are really good ones that you can do to test and see if there any mold is an issue. But also get out of the house for a week or two, maybe even do an Airbnb for a week and see where you're at. I mean, try to make sure there's just good ventilation, there's no condensation or moisture buildup, and there's no history of water leaks or visible mold. That's at least a good first step, and see what happens. Hope that helps. Let's see here. Christina writes in, have you heard of the Habit Personalized Food Program? I have not, Christina. I'm not sure what that is. It's probably some, you know, it's hard to say. People have these different marketing spins off of the same thing. So the question is, what are the foods? What's the timing of the meals? What do the macros and micros look like? That's kind of the meat and potatoes of it. Sherry writes in, hey, Sherry, what's a non-invasive way to get rid of belly fat? Cool sculpting. Yeah, so there's like some of the freezing of the fat can be really helpful because you can really destroy a lot of the fat cells with the freezing of it. I think it's called Cool Sculpt, or I think you may have mentioned it. Yeah, Cool Sculpting. Yeah, so you can do it with the freezing. That's one good way to do it. You can also do it with regular lasers, and then you can do it with lasers and Smart Lipo where they laser it and then suck it out, which is good too. But I would do the Cool Sculpt because you can actually destroy the fat cells that way. But, you know, make sure you're dialing in the diet. I know in the past when you've talked to me, you've done really well kind of on a ketogenic template with some intermittent fasting and some good workout timing there. So I would keep that going, and then you can use that as a method to kind of spot treat things. All right, Les writes in, my oat just showed up. It was super high in Sheraton A. Never heard of that marker before. Give me a little more detail. Oh, it's ochratoxin A, you must mean. You must mean ochratoxin A. Yep, that's a mold toxin. So, I mean, that means that you're getting it out of your body. So I don't have an issue with that. I mean, it's good that if you're getting exposed to mold, you're detoxifying it out. There's a lot of people that say, oh, well, because it's high in your urine, that means you're having an issue with it. Well, I'm more concerned if it's high in your house and not high in your urine, then you're not detoxifying it. So I'd want to look at your house. And then also if you're detoxifying it out, that's a good thing. So I'd want to know a little bit more about what's going on. All right, I'm shifting back here to YouTube. Let's see here. My Ink writes in, I have insomnia and low energy levels. I feel it's related to the adrenals as well as what's the best adrenal strategy. Well, it depends. So when it comes to energy, you want to look at adrenals, thyroid, and mitochondria. And then, of course, the deeper underlying layers, you want to make sure you're digesting and breaking down all your food because that's where all that energy comes from, all that food comes from. And then outside of that, there's different things that you can do supplement-wise if the adrenals are out of balance to support sleep, support healthy cortisol rhythm. We can also do certain amino acids to support melatonin levels too. And then the healthy diet and lifestyle things, blue blocking glasses, you know, screen time before bed, mitigated. I mean, I'm able to watch TV right before bed and go to bed, but that's because I have a good parasympathetic, sympathetic balance. Some people, they need a good hour or two to kind of turn their sympathetics off. The healthier you are, the more you can go like this, off on like a switch. The more your adrenals have been taxed, you need a little bit more transition time. So just keep that in the back of your head. Princess writes in, can you give some good tips for those of us who work night shift? I go to bed around 5:30 a.m. That's tough. So, I mean, definitely adaptogens, definitely vitamin D. ashwagandha, rhodiola, ginseng, and good adaptogens. Make sure you have really good room darkening shades as well, so you get really good sleep when it's light out, because the light can really affect your rhythm there. And I would do your best over time to not make this a permanent thing, and to try to find a job soon that gets you in a normal rhythm, because the World Health Organization found the only non-substance carcinogen known to man is shift work, in the same category as cigarettes and asbestos. So really want to make sure that if you're doing it for a short period of time, fine, but you really want to make sure it's not going to be the lion's share of your career working that time. Kitty writes in, if GI map retest comes back clean, but there are still signs of malabsorption of vitamins and minerals from food, what could be the cause? So, I mean, the first thing is just making sure, how do your stools look, right? Making sure your stools look good. They're regular. There's not a whole bunch of undigested food particulate. It's sinking, all those good things. Number two, making sure we have enough HCl to digest everything. That'd be the first thing I would look at. So I'd want to know those answers first. And as long as that's good, then I would just make sure we utilize supplementation. And I don't want to know what tests you're even basing that off of, though. So that's how we want to start first. What would increase one's tolerance to parasilver at a quarter of a dose? So, hey, Akbar, I know you've asked this question for me a handful of times. I've answered it. It's the same thing. So in general, Akbar, if you're having sensitivities to some of the killing herbs like the Para 1 or the GI Clear 3, it's just because you're killing things off. You're killing things off inside of your gut, and that puts stress on your detoxification, your lymphatic, and your immune system. So decreasing the killing, so going slower and titrating up into that ramp up phase for the killing is what you'd want to do, Akbar. And you'd want to follow the die-off reaction handout. I'd recommend throwing some binders like activated charcoal and or bentonite clay in there, 2 to 3 hours after food, 1 hour before food kind of thing to soak stuff up. And I'd also add in some ginger to help with inflammation and to help with the lymph. But that's what you'd want to do. It's the same thing. It's just you're killing stuff, and we need to go a little bit slower. And of course, if you're having issues, sometimes the herbs can be a little strong, and if they're creating irritation, then we may want to take them with food so they're not resting up against the gut lining. I hope that helps. Let's see here. My uncle writes in, I can see the session has started. Yep, we're here. We're rocking and rolling. Jack JMC, what do you think about taking raw milk to heal the gut after an infection's cleared? Again, it depends. Like the A2 milk's going to be better. It's going to be able to process and digest better. The protein's a little bit different with the A2 milk. Clarival, I think, has an A2 protein in there, which is better. Number two, I don't really do well with raw milk. I still get like loose stools and diarrhea and bloating and gas. So I stay away from raw milk either way. I just don't tolerate it well. So it really depends. But if you're going to try something, start off with raw goat's milk, a little less inflammatory with the casein. All right, I'm going to go back here to Facebook. Hey, give me some likes, guys. Give me some shares. Give me some hearts. I appreciate it. I'm going to be doing more YouTubes in 2019. I'm upgrading my office, camera, everything. So I look forward to connecting with y'all more. So just make sure you give me some shares. It keeps me motivated here. All right, let's see here. Nancy writes in, are there natural treatments for E-histo? Yes, there are. It's a really nasty parasite, so you got to be careful with it. Got to be careful. Herbs at much higher levels. Oil of oregano is shown to knock out E-histo. Wormwood at high levels. Berberine at high levels. Mimosa pudica at high levels. So you really have to make sure that you're doing this. Terry writes in, are you an MD or a chiropractor? I am a chiropractor / functional medicine doc. It's really interesting. I have lots of patients that ask me these things. Probably the least qualified person to be talking about natural health, diet, and nutrition is a medical doctor. They are the absolute worst. There's been studies showing that the average mother at home knows more about nutrition and diet than their average medical doctor. They typically get 1 to 2 hours, probably the worst amount of training possible in nutrition. And then because they learn so much about pharmaceuticals and surgical techniques, they tend to be a little bit more brainwashed to that being the only method, because the whole idea, if that's all they've learned, if it was important, they would have gotten it. So they tend to poo-poo and just push things off that provide great information. So they tend to be a little bit more closed off because of it. Hope that helps. But I do know a lot of great medical doctors that have gotten sick or have had challenges with their patients and have taken extra learning, taken nutritional certifications or courses, or learned online, taking things, and they've made themselves better, and they've developed, a functional medicine practice outside of it by need and necessity. So They are the exceptions for sure. Okay, let me keep on rolling here, guys. Lisa writes in, Deborah, I have Hashimoto's and doctor said intermittent fasting is okay. It depends. If there's a lot of hormonal imbalances and blood sugar issues, I'd like to hold off intermittent fasting until blood sugar and hormones is more stable, because that could be a little bit of a stressor, number one. Number two, if you're compressing the feeding window and you're already having a hard time eating enough and digesting enough, well, now you're cutting your feeding window down in half. So now you have less access to nutrition. So you got to keep that in the back of your head. Okay. Let's find out here where we're at. Oliver writes in, is it okay to be on HCL and Pepsin long term? Yeah, it's safe. I mean, if you look at the feedback loop hormone, which is gastrin, it does not decrease because you're taking HCL. And number two, once your digestion is normal and you're infection free and you're having good bowel movements, typically HCL and enzymes is going to be in your medicine cabinet as an as needed thing. So you're going to be using it for you're eating when you're stressed, you're eating on the go, you're eating a big meal, you're eating it's the holidays or Christmas or the New Year like we're in now. So that's where it's really good. But ideally, day in, day out, you shouldn't necessarily need it, but it's okay if you do it. I don't have a problem with it, because any supplement that allows you to get the most out of nutrition from your food, I consider to be a really, really good thing. Yeah, and Lane writes in, yeah, my MD was no help to me. That's what I see. Yep, I see the same thing. And even a lot of the medical doctors too. I find that get into functional medicine, they tend to be very hormonal heavy, meaning they're using hormones like supplements. They're using very high levels, and they tend to not work on the other things like the gut, like the diet, the lifestyle, the digestive. They tend to miss those components as well. Good observation. How does H. pylori affect the thyroid gland, specifically T4 free? My doc put me on some Thyroid, 30 milligrams. Is that a good approach? So 30 milligrams of MP, that's about a half a grain. So H. pylori can, number one, it's going to affect it because it can drive autoimmunity. So it can affect your immune system and cause your immune system to attack the thyroid. Number two, it can affect digestion. So it can affect you digesting and assimilating the protein and the minerals like magnesium, tyrosine, zinc, selenium, copper, vitamin A, a lot of these important nutrients that are needed to make thyroid hormone or to help convert and activate thyroid hormone. And obviously, if you're inflamed or stressed, that's going to affect that T4 to T3 conversion as well. So it can affect in all of those different ways. So is NP at half a grain? Okay, it depends. If your TSH is high and your thyroid hormone is really low, that may be a good approach, but we have to make sure all the other underlying issues are being addressed too. If they're being ignored, that's a Band-Aid approach. We really want to make sure we're addressing everything. Let me keep on rolling here. Guys, I'm getting so many questions from y'all. I appreciate the participation. It's just so hard for me to get to all of them. All right, so what I'm going to do, I'm going to roll through. If there's a kind of a repeat or it's kind of a, I consider to not be a question that's going to help more people, I'm going to just skip it, okay? Just because I got to roll through so many. Eye floaters. Eye floaters. Good question with eye floaters. So I would just look at inflammation. Get the inflammation dialed in. If eye floaters are still there, we can always support vitamin A, cod liver oil, liver, organ meat, those kind of things, krill oil. We can always add in extra herbs like bilberry or eyebright. These can be helpful as well. Petros writes in, do you consider baking soda test for low stomach acid level trustworthy? So I think that's the test where you take some baking soda. If you start getting burpy, that means that you had enough stomach acid before. Now you don't have enough. I just honestly look at digestion. I look at skin. I look at fingernails. I look at hair. I look at bloating, gas, reflux. I look at the quality of stool. I'll look at any of those issues present. I know the digestive system is struggling. So HCL is going to be great. It's kind of like, I think it's the most underrated supplement there is. So that's always going to be used for me and my patients if there's any issues in that area. And then typically we'll just go from 1 to 5 capsules, anywhere between 600 milligrams up to 3,500 milligrams, typically in the middle of the meal. And then we'll see if digestion improves, or we'll see how stools look or how things look over the next few months. Jack JMC writes in, what do you think of the Weston Price diet? I think the Weston Price diet's great. My biggest concern with it is they still emphasize lots of grains that are soaked. So I'm not a big fan of the grains that are soaked. Now, the healthier you are, you may be able to tolerate that. Sourdough, things that are soaked may be okay. But it does have a pretty good paleo template. It emphasizes organ meats. It emphasizes good fats. It emphasizes grass-fed butter, vitamin K2. It emphasizes, some starchy tubers, lots of vegetables, fermented foods. There's a lot of good things to it. I think the big X factor for me is going to be just the grains, though. Design Lover writes in, what's the best protocol for someone that had vitiligo for 20 years? 6 R's, yeah. So we got to go to the 6 R's. Got to work on the adrenals. Got to work on the gut. Got to address infections. Obviously, that's autoimmunity, right? Vitiligo is what Michael Jackson had, except he did the bleach pills or a bleach cream that caused everything to go. So he had no melanin left. And I have seen that get better. I've definitely seen it stopped and slowed down and stopped. And I've definitely seen there's some research on it where you can look at the study where it shows the before and after pictures, and there's massive improvement, which is great. So that some of that can improve as well. So you definitely want to go full autoimmune as well. Let's see here. What's your take on LPR, laryngopharyngeal reflex? So number one, work on the digestion. There's some diets out there called the fast track diet that's similar to an autoimmune kind of lower FODMAP template. I just tend to go to the AIP low FODMAP, make sure digestion's good and fix all the other underlying things. Lots of healing nutrients, no fiber, everything's cooked, steamed or sauteed, crock pot or Instapot. Lee writes in, how's my own health? My own health is doing great. I have a little cold that I, just got hit up with. I have a son who's about 1.5 years, and I find out he tends to get me if I get sick, it's this time of year, and it is from him. But I'm doing good. I mean, I'm able to work 12 hours a day, help patients, engage in technical conversations all day. So I'm not at 100%, but I'm at like 85 or 90%. So still doing good. Thanks for asking, though. All right, and I apologize. I have contractors in the background building my brand new office and studio downstairs beneath me. Office, studio, gym, sauna. So excited about that. That'll be around next month. So look for a new studio coming soon. Okay, where am I at? GSG, what's your viewpoint on mold illness that doctors are specializing in? So yeah, got to get your house tested. Got to get your house tested. See how you do when you're out of your house in a safer place for at least a week. LPR, we just talked about that. Monica writes in, husband has no gallbladder. Will ox bile help? Yes, but you also want to use enzymes, lipase, protease enzymes, and HCl. In my line, we would use HCl Supreme, Enzyme Synergy, and Liver Supreme. 1 to 5 on HCl, 1 to 3 on enzymes, 1 to 3 on Liver Supreme, and we want to make sure the stools are sinking. Korvac writes in, can ginger be used to raise stomach acid naturally? Yes, ginger is in that family of bitters, along with chamomile and gentian, orange peel, so it can definitely help be a gentle nudger of stomach acid. Is there any thyroid shots out there that can be taken once a month instead of a peel every day? No, I don't think that's possible, nor would you want that, because that's just not how the hormone is made from the thyroid gland. It comes out throughout the day. So I typically, if we're going to give it, it's typically twice a day. It's given orally. And if you want to maximize absorption, you can take it sublingually, which is great. All right. Could you talk about oral allergy syndrome, the condition where the body thinks common foods and are pollen type allergies, best way to supplement and deal? So yeah, with excessive allergenicity where your immune system is hyper responding, right? This is like someone knocks at your doorbell and you think Al Qaeda is at your door and you bring your gun, right? It's like, okay, well, probably not. It could just be the neighbor, wanting to borrow a cup of milk or something, right? Who knows? So it's that hyper responsiveness. So first thing is you got to get inflammation down on the body. When inflammation's up, everything goes wrong. So that it could be inflammation from food, from sleep, from poor digestion, from infections, from excessive bad fats. So you got to get the inflammation thing down. So there's a whole bunch of different vectors I just mentioned. I can literally talk about for an hour on each one. So that gives you a pretty decent overview. Let me switch back over to Facebook. Amy writes in, ideas to help a child who has fungus on and all toenails, has had it for years. Child is 9 years old. So first off, you want to get the diet 100% dialed in. So paleo template, no grains, no refined sugars, keep the fruits to the moderate to lower sugar kind. berries, green apple, grapefruit, maybe an orange, maybe a moderate apple like a Pink Lady or a Fuji, but keep it to lower sugar stuff. Healthy proteins, healthy fats. Eventually want to address the gut because you want to work on this inside and out. Topically, we can do an oil of oregano. Like in my line, we'll do the GI Clear 5 on the fingernail, on toenail. We'll even do something called Wonder Balm. That's a really good cream that we'll use. And then in my store, I have ones called the Herbal Foot Soak. Herbal fungal foot soak, and you mix that with apple cider vinegar. You soak your feet for 5 minutes, pull your feet out, let it dry, and then put on either the Wonder Balm or the GI Clear 5, and that works phenomenal. Okay. Asai writes in, there's a theory on the net that H. pylori is not curable. What's your opinion? What's the best approach? I mean, it depends. I mean, I'm a clinician, right? So I'm in the trenches. I don't work in this realm of like theoretical. So people come in with H. pylori infections. We treat it, we address, we make changes, they get better, and then we run tests and we see a lot of these things clear and patients get better. So like, you know, was it all because of the H. pylori the person was sick and that's why they got better? I don't think anything's all one thing. So we're making lots of changes with their diet, their lifestyle, but I know that when patients have these issues and we address it, they do get better, but I'm always moving, you know, a dozen levers at once, so to speak. So I never just go all in on this one thing will be it. Sometimes you get patients where you do one thing and it's like, they're just like, wow, you're amazing. And I'm like, well, you know, you're the easiest patient ever. So that happens sometimes. Lisa writes in, my sister has positional and central vertigo. Her legs feel heavy, like full of sand, and she falls down. Rheumatologists and neurologists say results are inconclusive. Tested for MS and lupus. Suggestions. Hard to say. So it's going to be gut stuff. It's going to be autoimmune stuff. So I would really look deeper at autoimmune for sure. You'd have to really see a good functional medicine doctor to get worked up. I don't even know how bad her diet is or how bad her lifestyle is. There could be a lot of things to look at. Matt White writes in, hey, Matt, we discussed lightheadedness before and possible electrolyte issues. If electrolytes are good, do you have thoughts on possible other causes, adrenal, low blood volume? So number one is just people need to get minerals, right? People don't get a lot of potassium. They don't get a lot of magnesium. I think some research showing that 50% of the population is deficient in magnesium. A lot of people don't get enough potassium, right? That's in green vegetables, and potassium and magnesium interact together. So just making sure you get it. People's diets are really poor. What does it take to get that? 6 to 7 servings of green vegetables, a full avocado, and a sweet potato or a squash, and you're right about 4,700. And then you can always do some new salt and some Redmond's real salt to add in some additional minerals. Rakesh writes in, hey Rakesh, I'm on the 5th hour stage taking Sacroflora and ProBioFlora, having trouble in sleep. Esophagus pain is back. Okay, so stomach discomfort, persistent, head time sleeping. What should I do with next consult? So the question is, what happened? What was going on when everything came back? Because you were doing so good when I chatted with you last week. What was going on? Any new foods you added in? Make sure you're not adding in new supplements and new foods at the same time. Did it happen after you came off the herbs? Or did it happen when you added in the probiotics? So I'd want to figure that vector out and control the diet change, control the new supplements, and see if any of those are part of it. So make some changes on your own. Try to control the variables. See the supplement reaction handout. And if we're still having issues, make sure you get on my calendar for next week. All right. Design Lover writes in, working with a patient in New York near the Jersey border. How would you able to get testing done? My dad needs help, has large gallbladder stone, just cancel gallbladder surgery. Yeah, so a lot of people, if they're in New York, not all labs, some labs can still be shipped out of New York. Others have waivers on them where you can just say that you shipped it outside of New York as long as you fill the waiver out. And again, I'm not telling anyone that they should break the rules, but you fill out that waiver, and technically you want to leave New York to send the test out. But typically Connecticut's okay as well. So I do have some patients go over to Connecticut if they don't want to fill the waiver out, but not all tests are that way. The GI map does not require that. The Dutch has a waiver as well, which is good. Monica writes in, what does reverse T3 tell you? Still waiting for the results. Reverse T3 tells me adrenal stress. It tells me potentially low levels of selenium. And of course, adrenal stress can be caused by physical, chemical, or emotional stress. So we want to look at selenium. We want to support the liver. We want to make sure the adrenals are dialed in. Jai writes in, how does H. pylori affect thyroid glands specifically? I already answered that question. I just joined. I have a problem. I feel like I'm colorblind. Well, I would just make sure all the nutrients for vitamin A and the antioxidants are kind of dialed in. with you. I mean, lutein is going to be really important. A lot of the nutrients like vitamin A, cod liver oil, liver. You can also do antioxidants for the eye, such as bilberry. That's really good for the eye. Matt writes in, I recommend you and your podcast and YouTube channel for looking. Yeah, thank you very much. Appreciate it, Matt. Elvis writes in, how to treat restless leg. Depends. There can be low levels of dopamine. There could be autoimmune component. There could be mineral components. The problem with lots of diseases, right? Disease is like, okay, so here's a symptom, right? And instead of saying like, this is the symptom, conventional medicine says the same thing in a different language called like a diagnosis. So it's interesting. Like my wife had some wrist pain, right, from doing a lot of the breast pumping for like breast milk pumping, and she's inflammation in this area. And she tells me, I know what disease I have. I know it. It's called De Quervain's tendinopathitis. I'm like, yeah, that just means inflammation in this opponens pollicis area of the thumb, right? But they call it De Quervain's, right? It's like, what's up with that? It's just a different language. They're saying the same thing. It's like, imagine me being like, oh my gosh, I have this awesome thing. It's called agua. It's like, well, you mean water, right? It's just using a different language to describe the same thing. It's kind of hilarious, but lots of different causes on why that may be. Oh my gosh, so many questions, guys. You guys are killing me. All right, I'll have to come back on Monday to answer more of these. I appreciate your enthusiasm, y'all. Really appreciate it. Okay, let me see. Let me just kind of scroll through here and just try to grab what I consider to be the most compelling questions for y'all. Okay, where am I at? Let's see here. Let me just hit Christina's question. My 18-month-old had a seizure 5 days after having vaccines, DTaP, and flu, and also had a bad bacteria, Shigella. I'm struggling with trying to find a cause. Yeah, I mean, it could definitely be the vaccinations. I've seen that time and time again. You can go to the National Vaccine Injury Center. That's Barbara Lowe Fisher's site. I'd also recommend filling out a VAERS report, VEA, Vaccine Adverse Event Reaction Database. I'd make sure you fill that out as well. The flu vaccine commonly has thimerosal, which is ethyl mercury in there. So it's very possible that's the case. If there's gut issues, it's 18-month-old, I would definitely use a infant toddler-based probiotic. There's one I use, and I'm giving it to my son now. Email my office by a company called BioRay, and it's called Belly. Man, what's it called? Give me a second here. I like that product because number one, it's got all the strains in there that a good infant needs. It also has Infantis in there, and it also has some chlorella. So if there's any mercury in your child's system, it'll at least help. We may want to look at doing some glutathione. That's tough, but I would definitely stop. I'd put a pause on all the vaccinations. I'd work on really getting the bacteria under control, the Shigella. So I'd really work on the probiotics to really knock it down. And I'd make sure that your child isn't having any diarrhea, because a lot of times that can cause food poisoning. So I want to make sure like their minerals are good. So like bone broth or like a really good electrolyte formula to make sure the electrolytes don't drop. If we have to do an IV, because that's bad, we'll make sure that's there. But there's definitely a connection with the vaccine. So I think you really got to be careful with that, especially the flu. I'd want to know if that flu shot had mercury in it, by the way. And let me tell you that product. That's called, yeah, Belly Balance. I give that product to my son every night too. But that's a good one because at least there's some good chlorella in there. That's a pretty good gentle detoxifier for mercury if that is there. So I would do that to start, and I would dig in deeper and schedule a call with me so we can chat about it soon. Okay. Hope that helps. And put a pause on your vaccination schedule until then. And I recommend, I have my position on vaccine, I don't really go into too much publicly. But in general, the rule of advice I would say is do all your vaccines one at a time. And if you have, never bring your kid in to get a vaccine, and make sure they try to wait as long as you can. I would do nothing in the first year, and one at a time, and never bring your kid in for a vaccine if they're sick. Sore throat, ear infection, headache, anything, runny nose, one at a time. All right. If you are going to vaccinate, if that's your plan. Okay. Let me keep on rolling here, guys. Okay, perfect. I think we hit all the major questions here today, guys. Okay. Hope that helps. I'm gonna be back on Monday. Okay. I'm gonna try to in the new year. I'm gonna try to have like a schedule where you guys can count on me being here at a certain time. I just try to jam these things in between patients and in between my lunch breaks. So sometimes I run late all the time with patients. Typically, I have 2 hours on my schedule for a lunch, but I normally only get 30 minutes. But okay, today was great chat. I appreciate your awesome questions, y'all. Give me thumbs up. Give me a share. I appreciate everything. You guys have a phenomenal weekend, and I'll be back. See, Monday the New Year? No, not yet, but I will be back on New Year's Eve. I'll be back on the 31st. All right, you can count on that. All right, guys, have a good one. Bye, y'all.